So good afternoon, everyone. In fact, good evening, everyone. So we are live now, and we have with us Dr. Soumy Singhal, and he has secured a great rank, right? He has got a rank of 785, if I'm not mistaken, Dr. Soumya.
Yes, sir, 785.
So Dr. Soumya is joining us. He's got a rank of 785, and I'm Dr. Vinish. I'm the faculty of anesthesia with PW Medit, and we'll be having a small discussion with Dr. Soumya regarding his preparation. And there was one thing, especially that he told me when he texted me, and that was about the YouTube live sessions, the MCQs, the TNDs that we have that we were discussing. So I'll be discussing small parts about him as to how it has helped his journey and taking inspiration from Dr. Soumya, how can it help other students as well. So Dr. Soumya, for 2 minutes, I'd like to take a small introduction from yourself as to from where have you done your MBBS and how was your preparation during your first 5 years, in the sense that how was your first prof, second prof, third prof in terms of
Yes, sir.
studies in the class? How
Yes, sir.
good did you fare there? Just a small introduction.
Okay. So, hello everyone. I'm Soumy Singhal and I'm from 2019 batch. I completed my internship this year in February and I cleared this NEET PG in my first attempt. So, during my MBBS, I was a very normal child. I used to get good marks, but not very good marks in my UCs. But yeah, I used to study. थोड़ा बहुत I used to
मतलब
study every
बेसिकली
time.
थोड़ा थोड़ा पढ़ाई की है हर साल में. पॉइंट इज
हाँ
दिस, हर
थोड़ा
साल
बहुत.
थोड़ा थोड़ा
Yes, sir.
पढ़ाई किया है, पूरा ही बंद नहीं किया था. बट द पॉइंट इज
Yes,
दैट
sir.
you have studied a little bit in every year, so you have
Yes,
some
sir.
idea about all the topics, and right from the very beginning it's not that you are absolutely zero in all the subjects, right?
Yes, sir. Yes, sir.
And when was the dedicated preparation for the NEET PG that you started? Was it during internship or was it after internship? Because you got about 6 to 8 months after that as well.
Yes, sir. So basically, in our college, most of our seniors, they get very good ranks with their internship. So we are quite focused towards the NEET PG from the final year itself.
Okay.
But I was, fully dedicated for the preparation in my internship only. And after internship, it was the time when, I did most of the part of the
Right. So
preparation.
you were focused with the fact that during the internship you took good time, you prepared well, and after that, of course, since you got some time, you were absolutely focused about it, and this helped you crack
Yes,
your
sir.
NEET PG.
Yes, sir.
Specifically, when I was talking to you, Dr. Soumya, you had mentioned about me the text that you sent me, and that that
Yes, sir.
elated me so much once I got your text that that you secured a rank, and I was so happy about it. So,
Yes, sir.
you specifically mentioned about the test and discussions, the TNDs is were there, the questions on the app, we had YouTube live sessions. So can you just let us know as to how this helped? I will ask you about the previous preparation also, but specifically zeroing on to the point about the text that we had, the discussion that we've had. So how about the TNDs? How did they help you? How about the questions of the app on the YouTube? Like if you could just, take us through that.
Yes, sir. So basically, I used PW mainly for the short subjects, that
Right.
is for the anesthesia, radiology, and psychiatry. So basically, the lectures which were conducted towards the end, that is the YouTube sessions,
YouTube
they
session,
were
right.
literally so crisp and concise. Like
Okay.
I was on the verge that I'll not do these subjects, I'll leave them. But when I attended these lectures, I got so much of confidence boost, and I was so sure that I am getting 5 to 10 questions from these subjects, and they will be correct for me. So that confidence boost was, very helpful for me in the last days, because the lectures which were conducted, they were very crisp,
Yeah, that's
which
what I
is
said कि
what we
all
need.
of us,
Yes, sir.
हम लोग जब अपना टेस्ट एंड डिस्कशंस भी रखते हैं, तो ऑफ कोर्स वी टेक इनटू कंसीडरेशन जो पीवाईक्यूज एंड पीवाईटीज तो है ही है, बट वी आल्सो इंश्योर इन द सेंस दैट इट कवर्स एवरी पार्ट of the subject,
Yes,
and
sir.
nothing is kind of left out, which I've seen with all other branches also. So a lot of students did message us that regarding those test and discussions in the YouTube live sessions, and we are glad to know that they were of some help to you, and hopefully they will be help of to some other students also. Also, one point that I have that I wanted to ask you is that, towards the end, how did you divide your time? Because a lot of students ask us, like when I tell a student the last 1 month is remaining and you have to cover 19 subjects, and remember 19 subjects to revise in 1 month is not easy, even if you give one day. But the point, and plus you have to solve your MCQs, वो भी पढ़ना है हम लोगों को, हम लोग अपना
Yes, sir.
PYQ भी देखने हैं, PYT भी देखने हैं. तो मुझे
Mhm.
एक थोड़ा सा आइडिया बताओ कि लास्ट 1 मंथ में आपने ऐसा क्या किया जिससे यू फेल्ट कॉन्फिडेंट. I'm not talking of YouTube sessions and the TNDs now, but I'm saying
Mhm.
how did you divide your time in such a way that you could be focused about studies and not get worried with the fact that there is such a huge amount of subject that I need to study and complete in 1 month towards the end. उसको कैसे manage किया?
Okay. So basically, last time के अंदर what I did was I divided. First of all, I sat down and I divided my time in different slots. Like मतलब मैंने सब्जेक्ट्स की ग्रुपिंग करी थी, लाइक कि शॉर्ट
हाँ,
सब्जेक्ट्स मेरे को किस तरह से करना है, सर्जरी मेरे को रेडियो के साथ पढ़नी है, मेडिसिन पैथ और फार्मा ये मेरे को साथ में पढ़ना है। क्योंकि उस टाइम तक हम लोगों को इतना पता चल जाता है कि कौन सी सब्जेक्ट के अंदर क्या क्या कॉमन पार्ट्स है। और
राइट।
अगर हम लोग उस टाइम पे उन सारी चीजों को एक साथ पढ़ लेते हैं, सो दैट इज अ वेरी 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 गुड कॉन्फिडेंस बूस्टर। बिकॉज हम एक चीज पढ़ रहे हैं और हमारी तीन सब्जेक्ट्स
तीन
का
सब्जेक्ट
मेजर
कवर,
चंक कवर होता
एग्जैक्टली।
है।
मेरे इनफैक्ट मेरा भी
यस
एक
सर।
यूट्यूब वीडियो है जिसपे मैंने ना ये थोड़ा सा डिस्कशन किया था बिफोर द एग्जाम
यस
गॉट
सर।
पोस्टपोन। और
हम्म।
इवन आई ट्राई टू से द सेम थिंग बिकॉज हम लोग भी इसी तरह से पढ़ते थे। बट माई पॉइंट वॉज जस्ट टू आस्क यू ऑल्सो इफ यू डन सिमिलर थिंग। बट टेल मी वन मोर थिंग दैट नाउ सिंस यू ग्रुप्ड अप योर सब्जेक्ट, you've decided that you're going to study medicine, medicine and patho and maybe pharmac together, or maybe
यस
radio.
सर।
You combine three subjects together and you're studying
हम्म।
them. तो एमसीक्यूज कैसे सॉल्व किए? लाइक तीन सब्जेक्ट कंबाइन भी किए प्लस आपको एमसीक्यूज भी सॉल्व करने हैं, तो उस समय एमसीक्यूज कैसे डिवाइड किया टाइमिंग पर डे? एंड इफ आई
तो
विल आस्क
बेस
यू, इफ आई मे आस्क कि कितने एमसीक्यूज यू थिंक दैट वन डे, इन वन डे हाउ मेनी एमसीक्यूज डज वन नीड टू सॉल्व टू बी कॉन्फिडेंट कि यस नाउ आई कैन क्रैक द एग्जाम?
यस
कितने
सर।
होने चाहिए मिनिमम
सो बेसिकली लास्ट वाले डेज के अंदर एटलीस्ट 100 एमसीक्यूज हम लोगों को करने ही करने हैं।
पर डे?
जिसमें से पर डे,
राइट।
जिसमें से 50 एमसीक्यूज शुड बी सारे सब्जेक्ट्स के, जो भी
ओके।
हम पढ़ रहे हैं नहीं पढ़ रहे, मतलब दैट शुड बी बेसिकली अ रिविजन विदाउट एनी टैग्स। और जो
राइट।
50 क्वेश्चंस हैं वो हम लोगों को पीवाईक्यूज करने हैं, जो सब्जेक्ट्स हम लोग पढ़ रहे हैं उससे रिलेटेड।
Right. Now my point is कि you are saying 100 questions जो किए, तो these 50 questions that you saying they're different from the 100 questions that you said, कि दोनों combined है, मतलब 50-50 या 100
सर
और 50?
सर 50-50 दो
ओके।
दो पार्ट्स के अंदर डिवाइड
दो,
कर लिया डे
हाँ,
को।
डिवाइड करनी,
हाँ।
करेक्ट।
सुबह सुबह हम लोगों ने स्टार्ट किया, जो भी सब्जेक्ट्स हम आज पढ़ने वाले हैं वो वाली सब्जेक्ट के 50 क्वेश्चंस के पीवाईक्यूज कर लिए।
करेक्ट।
सो
करेक्ट।
हमको जिससे पता रहेगा दैट व्हाइल वी आर स्टडिंग वी आर फोकस्ड ऑन टू द पीवाईटीज वाला पार्ट।
प्लस
बिकॉज वी
यस,
नो
योर माइंड
पीवाईटीज।
ऑटोमेटिकली गोज टू दैट
यस सर।
टॉपिक जो क्वेश्चन पूछा हुआ है, और उसी पे
यस सर।
ध्यान
यस सर।
दोगे, वही रिवाइज भी करोगे, वो आपका हो
यस
जाएगा।
सर।
एंड देन इवनिंग में फिर क्या किया? रिमेनिंग 50 क्वेश्चंस वर फ्रॉम सम अदर सब्जेक्ट?
Yeah, not some other subject, from all the subjects. No
ओके,
tags,
मिक्स्ड बैग,
nothing.
सॉर्ट ऑफ अ मिक्स्ड
Yes,
बैग,
a mixed
मिक्स्ड
bag,
बैग लिखे,
mixed bag.
हाँ, मिक्स्ड
Yes, a
बैग।
mixed bag. Mixed bag 50 questions, जिससे सारी subjects से हम एक बार टच में भी रहेंगे. Because
राइट।
it's very important to be in touch with all the
ऑल द
subjects.
सब्जेक्ट्स,
क्योंकि yes
एब्सोल्युटली।
sir, very very important.
तो दैट मीन्स योर स्ट्रेटेजी वाज वेरी गुड यार। यू आपने स्ट्रेटेजी बहुत अच्छी बनाई एंड इट्स वंडरफुल दैट यू वेंट फॉरवर्ड विद दिस थिंग।
Yes
राइट।
sir.
ऑल्सो एग्जाम के एक दिन पहले या दो दिन पहले, तो ये तो हमारी बात हो गया फॉर लास्ट 1 मंथ, बिकॉज देखो उसके
Hmm.
पहले तो पीपल गेट टाइम एंड दे आर स्टिल स्टडिंग। वी डिस्कस्ड
Yes sir.
अबाउट लास्ट 1 मंथ हाउ यू डिवाइड द टाइम।
Hmm.
स्पेसिफिकली स्पीकिंग लास्ट 2 डेज, उसमें टेंशन बहुत है, 19
Yes
सब्जेक्ट्स
sir.
तो पढ़ नहीं सकते। तो लास्ट
Yes
टू
sir.
डेज में व्हाट आर द सब्जेक्ट्स दैट यू कॉन्सेंट्रेटेड अपॉन, और व्हाट इज द टॉपिक्स दैट यू आर थिंकिंग अबाउट? लाइक फॉर एग्जांपल, वर यू लुकिंग इनटू द पीएसएम, वर यू लुकिंग इनटू चार्ट्स, वर यू लुकिंग इनटू फार्मैक और मे बी एनाटॉमी, या यू आर
Yes
थिंकिंग
sir.
क्लिनिकल पढ़ें, शॉर्ट सब्जेक्ट्स पढ़ें, या शॉर्ट छोड़ दें पूरा एंड लेट्स गो टू फर्स्ट
Hmm.
प्रॉफ सब्जेक्ट? इन द लास्ट 2 डेज क्या कॉन्सेंट्रेशन था रिगार्डिंग
So
सब्जेक्ट्स?
basically, yes sir. Sir, so last 2 days के अंदर I had some topics in my mind. मतलब जितने भी कैंसर्स थे सबकी स्टेजिंग और
हम्म।
ट्रीटमेंट्स मैंने अपने एक अलग से टैब के अंदर नोट डाउन कर रखे थे।
राइट।
जो भी इंपॉर्टेंट टेबल्स थी पैथ की, फॉर एग्जांपल ट्यूमर मार्कर्स की, या फिर जो भी आईएचसी मार्कर्स की, तो वो सब मैंने अपने टैब के अंदर लिख रखे थे।
ओके।
जो माइलस्टोन्स होते हैं पीडिया के अंदर वो मैंने अपने टैब के अंदर लिख रखे थे, और जो बीएनएस और बीएनएसएस है एफएमटी के अंदर, तो मेरे ये 4-5 टॉपिक्स
But
मैंने
these are
सोच
the
रखा था।
your own notes जो खुद से लिखे हैं, right? The ones which you
यस
made
सर। यस
yourself.
सर।
I
यस
want
सर।
to say this point to all the students who are listening to this, because a lot of times when we as faculty, when we go and tell the students write down, तो आजकल क्या है, देखो notes हर जगह available है, right? It's totally available.
यस
But when we say ना कि what you write is what you remember, plus एक छोटी एक कॉपी होती है जिसमें हमने अपना सब शॉर्ट बना के रखा होता है, तो
सर।
we always say make something like that so that it stays with you and towards the end ये सबसे ज्यादा हेल्प करता है। लेकिन that's what I say, people like you have done it, a lot of students don't do it, but I feel that as you said, something like this should be done, that you make out your points, you make out your markers. See, someone else might not be knowing, must be knowing cancer very well, उन्होंने पढ़ा होगा अच्छे
सर।
से। Maybe you have not studied उस समय इतना, and you know कि this is my थोड़ा सा weak point, and I know questions are going to come from here. Why to make it my
यस
weak
सर।
point? So identifying those weak points, taking care of them, and then to it's like just like a clinical diagnosis.
यस
इफ
सर।
यू
यस सर।
थिंक इफ यू थिंक कि भाई कुछ प्रॉब्लम है किसी को, तो क्या करोगे? तुम एनालाइज करोगे, उसके बाद उसका ऑप्शंस निकालोगे और ट्रीट करोगे। तो यहाँ पे अगर
Yes, sir.
हमको ये समझ में आता है कि एक टॉपिक मेरा ठीक नहीं है और मे बी आई एम नॉट वेल वर्स्ड विद इट, तो व्हाट विल यू डू? एनालाइज द टॉपिक इज नॉट वेल, make your
Yes,
notes
sir.
about it and treat it by studying it and solving
Yes, sir.
MCQs.
Yes,
And I
sir.
think your strategy has gone very well, yeah. Really done well. You have made everyone proud. You made your parents proud. You made all of us
Yes,
proud.
sir.
And as a team PW Med, we are glad to be a part of this journey of yours, where you specifically you told us about the fact. So thank you so much for joining with us, and all
Yes,
the
sir.
best. One more thing, एक मैं पूछना चाहता हूँ
Yes, sir.
कि
Yes,
what
sir.
is the subject of choice? Now that you got all the subjects on your platter, you can choose any subject that you want. Which is the subject of your choice that you are looking into? Are you looking into a surgical bent, or are you looking into a medicine point? What is it that you feel that you want?
Yes, sir. So basically, I'm pretty sure that I'm going to go towards the medical side.
Medical side.
Yeah, not towards the surgical side. And I'm confused between medicine and pediatrics only. So, I'll consult with some teachers, some seniors, and then maybe I'll decide.
Acha, I'll say just one thing. Stick to a branch which you think, for the next 20, 25 years, you're going to be very happy with that. Okay. It
Yes,
does
sir.
not necessarily mean that it has to be an end branch. A lot of people, when we speak about medicine, they will tell you that medicine is not an end branch, and you have to go and do cardiology, DM करना पड़ता है, gastroenterology करना पड़ेगा, nephrology करना पड़ेगा. See, don't look into all that. I'm telling you there is lack. I'm into clinical practice for so many years now. I'm telling you
Yes.
there's lack of good physicians also, plain physicians, physician as in not just you have to be super specialist like DM. Even that MD medicine, that old time MD medicine is lacking in private practice, in hospitals, in corporate hospitals. There also where we work, people are looking out for MD medicine. You're not getting that MD medicine because everyone is super specialist or
Yes,
they're
sir.
preparing for it. Okay, so there is a demand for every branch. There's a demand for everything, but you have to pick up a branch of your choice. For example, me, I have done chest medicine also, but
Yes,
I
sir.
did not like the OPD practice, so I was more fine with anesthesia, and that was what I'm continuing even now. Right. So similarly, someone might have that, that I want to get that surgery done, or maybe just cut it and get the things out. They have a surgical bent of mind. So definitely for you have to look whether you have to look into adults or you have to see pediatrics. Now
Yes,
it
sir.
depends with whether आपको बच्चों के साथ खेलने में अच्छा लगता है या you want to sit with adults. But yes,
Yes, sir.
pediatrics is a good branch. Even I like it. मतलब बच्चों के साथ मतलब ऐसे भी if you're stressed out that day and you find kids running around all over you in the wards, that day goes very well. No doubt
Yes,
about it.
sir.
But yes, one point is there about pediatrics which I feel is that by chance when you see that child suffering and you are unable to do
Yes,
something
sir.
for that, so it hurts you a little bit because yes, you get involved with the treatment also. तो थोड़ा सा वो रहता है बट वेरी नाइस टॉकिंग टू यू डॉक्टर सौम्य एंड
Thank
बहुत अच्छा
you.
लगा आपसे बात करके एंड होपफुली द स्मॉल डिस्कशन दैट वी हैड इज गोइंग टू बी हेल्पफुल टू ऑल अदर स्टूडेंट्स हु आर लुकिंग इनटू इट and the other people who are preparing can gain something out of the discussion that we've had. So all the best to you, Dr. Soumya. Do well. Stay in touch. Let us know what branch you have chosen. All right.
Sure, sir. Thank you so much, sir.
Take care. Take care and all the
Yes, sir.
best.
Okay.
All the
Thank you,
best.
sir.
Yeah.
Thank you.
Bye bye.